I'm delighted to introduce this session on guidelines. As a chair of the ESMO guideline working group, I'm happy to present this cooperation of ESMO with also the European Society of Digestive Oncology. We presented last year the group of guidelines on pancreatic and also on liver cancer, and I would like to give you some thoughts on how ESMO is producing guidelines. So, what are clinical practice guidelines? Those are systematic developed evidence-based statements aiming at three different points. The first is patients, the second first is practitioners, doctors, second is patients, and the third is health authorities. So the aim of guidelines, the first one is to assist practitioners in appropriate clinical decision-making or aiming at best clinical practice. We also have the second aim, which is to improve the quality of healthcare and outcomes, thinking that if good clinical practice are implemented, then the outcome of our patients is going also to improve. And the third one is also to give some input to or to influence the health authorities or national policies for efficient allocation of resources for better delivery systems. So ESMO began this work on the development of guidelines in 1999 in order to help define the minimum standard of medical oncology practice for Eastern European countries. And from 2001 to 2005, they were called ESMO minimum clinical recommendations. After 2006, we started to produce the ESMO clinical recommendations addressing a wider audience. And also in 2007, we started a different way of doing guidelines through consensus conference derived guidelines, and we have already worked on the prostate, colorectal and lung consensus conferences. And since 2010, we call them ESMO clinical practice guidelines. So every year, a number of those guidelines are published in Annals of Oncology. In the supplement of Annals of Oncology, it is published at the same time as the ESMO Congress about September takes place. So the short size guidelines have an average page number of 5. Those are evidence-based statement, disease of topic-oriented, and they are available on the ESMO website. And we started publishing about 57, 55 guidelines every year, but we decided to focus only on those areas in which some important advances are made, and so we renew every year about 20 of those guidelines. And at this moment, we have 57 guidelines available, and we aim at elaborate on 60 by next September. So the consensus conference derived by guidelines are different because they aim to address pre-selected questions to 30-40 multidisciplinary experts on a specific tumor types, and after 1 to 2 day meeting, they have to come out with a manuscript. This is funded by ESMO or other professional networks, and they are planned to be updated every 2 to 5 years and also published in the normal regular issue of Annals of Oncology. So we have worked also on the dissemination and promotion of our guidelines. They are published, as I told you before, in an annual supplement of Annals of Oncology. They are also available for free at the ESMO website or also on the Oncology Pro website. They are translated to many languages, and also in our annual congress we have a session, interactive guideline session, in which some clinical cases are presented the same way we are going to do here, and also the relation with the guidelines is discussed. So concerning the use of our guidelines, we cannot tell you how, if our guidelines are implemented, but we are quite happy because they are consulted by not only by ESMO members, but they are used worldwide. And despite the fact that we produce in the last 2 years only 13 or 21 new manuscripts, the number of downloads, average downloads by manuscript, is increasing dramatically. It was about 2,000 in 2009, and last year it was almost 5,000. And in this year, we plan also to have quite a significant number of renewed guidelines of the short version. Some guidelines are going to be totally new, published for the first time by our working group, and as I told you before, this is going to be available by the next ESMO Congress, which will take place in Amsterdam next September. We have also a version we have already published 6 pocket guidelines, and we plan to have some new titles at the end of this year, particularly lower GI, upper GI tumors, gynae, head and neck, and lymphomas. So we have also version for patients. This is a cooperation with reliable cancer therapies, and those patients' versions are produced not only in English but also in Dutch, French, and Spanish. So I would like to thank you for your attention, and we would like to start then this session by the presentation of a clinical case.